What happens as part of the visit? The purpose of a hearing test is to protect the individual's hearing ability by identifying any decrease in hearing function at an early stage, so changes can be made in the workplace to stop or limit any progression of hearing loss. Secondly, they help to protect other colleagues. If any reduction in hearing ability is found in one individual, then others may be affected and their health can then also be reviewed. The Latus technician will first inspect the individual's ears with a handheld otoscope to check for any medical conditions or abnormalities and to ensure that any hearing problems are not down to a buildup of excessive earwax. The individual will also be asked several comprehensive questions regarding their hobbies, medical history, and previous exposure to noise to help form a decision regarding potential noise-induced hearing loss. Once this is completed, the employee will wear some headphones and will be sent tones at different frequencies for them to respond to. The aim is to find the quietest level of sound that the individual can hear. The individual will be placed into a HSC hearing category and advised that their results will be escalated to the clinical escalation team for further review. Once the visit has been completed, the results are scrutinized by the clinical escalation team, who will determine if an onward referral is required to an occupational health physician. To form this decision, the clinician will review the individual's test results, responses to specific questions, in addition to comparing the results of any previous assessments, if available. Essentially, they are looking for potential noise-induced hearing loss, which is a notch or a bulge in the 3, 4, and 6 kHz. In some instances, the escalation team may determine that there is no further occupational health intervention required and the individual is to attend their GP solely, as the adverse test results are not occupational related, for example, ear infection or hard wax. The individual should therefore take the outcome letter to the GP for further escalation into the NHS. The HSC make it clear that there is a potential noise-induced hearing loss that the onward referral to occupational health physician is required. It is no longer appropriate to refer individuals to the GP for noise-induced hearing loss, as they do not have the necessary skills, experience and competencies to advise employers on the fitness to work with noise. At Latus, we fully appreciate that the number of referrals for potential noise-induced hearing loss will increase in the short term due to the HSC guidance changes. We have therefore heavily invested in our technology triage process and question set to provide cost-effective solution where the results will be reviewed remotely to aid a decision for fitness for role.